We are what our neurotransmitters do with us.
Certain health conditions including depression can arise due to imbalances in the levels of serotonin and dopamine in your body. Medications, as well as lifestyle changes like exercise and stress management, can help to regulate these levels. Here we will have a short discuss about serotonin and dopamine functions, as well as the similarities and differences between these two neurotransmitters. Serotonin and dopamine are both key neurotransmitters linked to your overall well-being, but they have completely different chemical properties and pathways for how they work. Serotonin, also known as 5-hydroxytryptamine 5-HT, is a neurotransmitter that is produced in the part of your brainstem called the raphe nuclei. Serotonin is made from an amino acid called tryptophan. This neurotransmitter is best known for its ability to boost your mood, but it also plays an important role in digestion and the immune system. Dopamine. Dopamine is made in the base of your brain through a two-step process. An amino acid called tyrosine is first made into another amino acid called L-dopa, which is then made into dopamine. Dopamine is known as the pleasure neurotransmitter. That's because dopamine is responsible for making you feel good after you've had eaten a good meal or done any other activity that activates the reward system in your brain. It also helps you pay attention and learn new information. Dopamine has lesser-known functions as well. This neurotransmitter plays a role in muscle movements, management of heart rate, lactation, pain, sleep, and function of your kidneys and blood vessels. Similarities and differences. Serotonin and dopamine can both impact our mood, our digestive system, and our sleep. Some of these effects are similar. For example, low serotonin and low dopamine can both lead to depression. However, some of the effects are different. For example, while both serotonin and dopamine can impact digestive health, low serotonin can cause constipation, while low dopamine can cause electrolyte imbalances. Causes of serotonin and dopamine imbalance. Serotonin and dopamine deficiencies can occur for a variety of reasons. Your body might not make enough of these neurotransmitters or be able to respond to them appropriately. Certain medications can affect levels of serotonin and dopamine as well. Other causes of these deficiencies are medical conditions such as Parkinson's disease, brain injury, chronic stress, low-carbohydrate diets, not enough omega-3 fatty acids, low levels of vitamin D, not enough sunlight exposure. Signs of low serotonin and dopamine. Low levels of serotonin or dopamine can cause similar symptoms. However, dopamine also affects more the muscular system while serotonin does not. Serotonin deficiency can cause decreased energy levels, sadness, feeling hopeless, mood swings, increased or decreased appetite, difficulty sleeping or sleeping too much, carbohydrate cravings, gastrointestinal issues, sexual dysfunction, compulsive behaviors. Low levels of serotonin can also cause mental health conditions, such as depression and anxiety disorders. In severe cases, it can lead to suicidal thoughts. Symptoms of dopamine deficiency can include difficulty paying attention, lack of motivation, depressed mood, lack of pleasure in enjoyable activities, decreased sex drive, memory issues, restless legs syndrome, tremors such as hands shaking, muscle cramps, difficulty with balance and coordination. Dopamine deficiency can also occur with Parkinson's disease, a progressive neurological disorder that develops when cells in the brain that produce dopamine no longer function correctly. This condition causes tremors, stiffness throughout the body, difficulty with balance, and slow movements. Serotonin is a key neurotransmitter associated with depression. This chemical has a significant impact on mood and positive feelings, such as satisfaction, joy, and empathy for other people. Depression is commonly treated with a group of medications called selective serotonin reuptake inhibitors (SRIs) that help boost serotonin levels in your brain. Low levels of dopamine can also contribute to depression. Inability to feel pleasure and lack of motivation are two symptoms of depression that have been linked to dopamine dysfunction. While SRIs are considered first-line treatment for depression, Medications that increase dopamine levels in the brain are sometimes prescribed in addition to these drugs to specifically improve energy levels and motivation. Serotonin is best known for its impact on mental health. However, most of the serotonin in your body is made in your gut, not your brain. This neurotransmitter helps control the release of digestive enzymes that affect the function of your intestines. Too much serotonin can contribute to GI disorders, such as irritable bowel syndrome. Too little serotonin can cause constipation. Unlike serotonin, most dopamine is made in your brain. In the digestive tract, a low amount of dopamine increases blood flow and helps your intestines absorb electrolytes. When serotonin or dopamine levels in our body are too high, can also cause unwanted side effects. If you think you might have issues with your serotonin or dopamine levels, talk to your healthcare provider. Small changes in your daily habits, with or without the help of medication, can make a big difference in your quality of life.